Namaskar to all. Welcome to Saffron Educational and Medical Foundation, an opportunity to be your own doctor today.
Now, forms and types of Parkinson's. We have 5 different types over here. So, first one is tremor dominant Parkinson disease. So, around you can say 75% of the cases are related with the tremors only. And this tremor dominant Parkinson disease is around happening age between the 45 to 55, where the hands, legs, chin, and our jawline is mostly affected. Generally, if the form of tremors are there, so the main you can say bifurcate, the head is not included in tremors because tremors are always there in the hand, feet, jawline, and chin only. This is a specific area, so you can bifurcate the type or the form of the Parkinson's. Second one is the partial instability gait difficulty. This is generally 25%, 75% most common is tremor. Rest 25% we include this type of Parkinson disease where the shuffling gait is there, balance difficulty is there, tendency to fall is there, and rapid progression is there. So in this partial instability gait means it shows the posture, how you walk, how you stand, the posture, that is we use the word as in science gait, gait. So partial gait, so how it comes to know, like the person who's suffering from the second stage, the shuffling gait is there, like like this vibration is there. If they walk, they may bend on a side, they cannot put their legs on a straight. Second, they are always need some help when they walk, otherwise there is a tendency like after 2 or 3 steps they may fall, right? Third one is a juvenile Parkinson disease, that is in the childhood. Fourth one is a young onset Parkinson disease that happens between the 25 to 35 of age. That's why it is called young onset. See, the cause and symptoms that already we discussed, because of sometimes head trauma, hereditary or genetic, this may happen in the early age also. And the last one is late onset Parkinson disease. Mostly it shows after the age of 60 plus. So this is just to understand how we can bifurcate or what is the type of Parkinson that a patient is suffering, right? Now this is the basic about the Parkinson. We check the cause, symptoms and different forms of the Parkinson disease. Now this is the things to understood biological scientific things. Now how you diagnose? What are the pathological things that helps clinical diagnostic? Right, everything when you want to treat a specific disease, that time your diagnostic must be proper, because it is said like if the diagnostic is proper, then you'll get the proper treatment. So treatment is concerned with the diagnostic things. There are different types of diagnostic. First of all, in this type of cases, the discussion, the conversation, asking questions, answers are most important. So anyway, whenever this problem arises, so first of all we see the family history. On that basis we come to know rather it is genetic, hereditary or what. So family history is one of the most important thing, like those who have the patients previously in their family, like grandparents, parents, siblings, are they suffer from Parkinson problems, maybe minor or major. Physical examination, second most important thing when you visit the doctors, so they see the gait, postures, the tremors, they are one-sided or they are resting tremors, continuously is there. According to that, they'll suggest the further test. Some neurological examinations are necessary to know how is it affect on their memory gland or the brain functions or not. The dopamine level and other neurotransmitters are affected at what level. So this is also one of the neurological examination is very important. Now, if after this three examination, if doctor is sure about this problem, then they may suggest you CT scan and MRI, which are imaging studies. With the help, they come to know the exact damage of because of the Parkinson disease in the brain, neurons, the rhythm of neurons, the cycle of neurons are damaging or not, if there is any blood clots created or not, anything which can be imaging with the help of CT scan and MRI. There is another CSF culture test, which we had just seen the root cause. Any type of viral infection is also responsible for Parkinson disease. So with the CSF culture, we come to know about what type of infection is there. Like, see, if you say there is no family history, with the help of physical examination, you cannot find out anything. If that patient is not a longer period on any medications, there is no genetic problem. So still you want to know what is the reason. So this is also very much helpful if there is any viral infection inside the brain. So they can go for CSF culture also. Now, after this diagnostic, the next stage is to suggest how to treat medicines. So according to the science or allopathy, there are some type of medicines which helps to increase the dopamine level, which indirectly shows improvement in their rigidity of muscles, the movement, tremors are subsided. So these are the medicines they can suggest. So anti-Parkinson medicines are there, which helps for the improvement of the muscle movement also. So they are like levodopa and carbidopa. Dopamine agonistic bromocriptine medicines are there. Anti-cholingeria drugs are there, like benzotropine and everything. So these type of some balancing of dopamine level, there are certain medicines that your doctor prescribed after the proper diagnostic also, and according to that they will suggest a specific dose. So this is what the science or the allopathy point of view.